that we are only looking for the night blindness and we forget the associated systemic disorders. Most of the ophthalmologists and even senior ophthalmologists, according to Professor Mohammad Dawood, some people are not looking for systemic disorder. They are just fixed to eye. And nowadays, the multi-centers that are only looking for eye subspecialty are going to be discouraged because a person will go first to the eye unit and then general ophthalmologist and then subspecialty, and again in subspecialty they will go to another subspecialty person. Now the person is just wasting time, and when he reach to the proper person, he suppose retinal detachment is a serious and emergency situation, and if first he will be examined by general ophthalmologist, then subspecialty, then again subspecialty, so the detachment will convert to total retinal detachment, and the prognosis will be worse as compared to his presentation. Therefore, nowadays, the subspecialty like here that is going to be developed is now going to be discouraged. All these people should be present in one unit. Now we come to our this night blindness. Night blindness is a feature of many diseases. On a worldwide scale, it is seen commonly in association with vitamin A deficiency. Don't forget the word commonly related to the word, but it is also a feature of many interesting but rare inherited disease. Rare, the word is rare, of the choroid and retina. The most common cause of night blindness is myopia. Now here we didn't mention what types of myopia. Severe myopia, high grade, pathological myopia, any myopia can present with night blindness. One thing that I add to your knowledge, that myopia is a protective state of the eye for development of diabetic retinopathy. प्रोटेक्ट ये नहीं है कि प्रिवेंट यू, प्रोटेक्ट यू, प्रिवेंट नहीं करते, लेकिन थोड़ा बहुत एज कंपेयर टू नॉन मायोपिक यहाँ पे डायबिटिक रेटिनोपैथी थोड़ी सी लेट डेवलप होती है. देयर मे बी डिफरेंट मल्टीपल रीजन, but you just remember that myopia may be considered as a protective covering for development of diabetic retinopathy in diabetic patients. Now, what is the main problem with night blindness people? The symptom of night blindness, nectolopia, may be the primary visual complaint of a patient, but it is often only one element of the visual problem. Patient may not be presenting, important hai, patient may not be presenting with symptom of night blindness unless the patient is asked directly about problems with night vision. The symptom may be missed. ये अक्सर होता रहता है. When confronted with a patient with night blindness, there are large number of possible causes, and a methodical approach is needed to reach a diagnosis. These diagnoses may have implications for other members of the family. Now, problems, how we will manage these problems. Identification of the cause of night blindness require a careful and detailed history followed by a full ophthalmic examination with particular emphasis on examination of the posterior segment of the fundus. बहुत ज्यादा इम्पोर्टेंट है ये चीज। और अगर आप लोगों में से कोई ऑफ्थल्मोलॉजिस्ट बनना चाहता है तो वो फंडस एग्जामिनेशन हर पेशेंट में कर लें। However, further investigations such as perimetry, visual field, that is, dark adaptometry, electroretinogram, and electrooculogram may provide additional useful information. This is related to the eye. There may be a need of audiogram. Audiogram is used for ear hearing purpose to know about the deafness, the depth of deafness. ENT people are doing these people. Most of the congenital disorder are also associated with deafness, ataxia, problem in walking, insomnia, loss of smell. So different others problem are associated with night blindness. So one who is going to examine a night blindness person should take proper history, proper complete thorough, must perform this test accordingly. Must word is not for all, accordingly. Once a provisional diagnosis is made, it may be appropriate to perform a full neurological or systemic examination. It may be relevant to examine the patient's relative. Now, approach to the etiologies of this night blindness. In order to approach the problem of night blindness in a systematic manner, it is necessary to have a working classification of the possible etiologies. किसी को पता है, आप लोगों ने जो BVS में किया है कि नाइट ब्लाइंडनेस की कोई खास क्लासिफिकेशन आप लोगों को किसी को पता है? Any one of you? किसी को पता है? असद, आवाज आ रही है?
जी सर, आ रही है।
यस सर, आवाज आ रही है।
तो आप लोग जवाब नहीं दे रहे हैं। किसी को क्लासिफिकेशन का पता है?
नो सर, नहीं
वो
पता।
हमने तो वाइटमिन ए वाली ही पढ़ी थी क्लासिफिकेशन, ये इस तरह अलग से इसकी नहीं पढ़ी।
सर वो वही नाइट ब्लाइंडनेस वाला जिसमें
आप लोग
कंजक्टिवल जीरोसिस और
आप लोगों के जहन में
वो
कौन सा क्लासिफिकेशन हो सकता है? किस तरह हम इसको क्लासिफाई कर लें? क्योंकि ये मेरा अपना क्लासिफिकेशन है, अपना नहीं है लेकिन कलेक्ट किया है। ये इंटरनेट दोबारा मैं पीको में हूँ, दोबारा ये इंटरनेट में गड़बड़ आ रही है, लेकिन कोई जरा बता सकता है कि किस तरह क्लासिफिकेशन बनना चाहिए एज ए एमफिल स्टूडेंट?
On the basis of age, sir.
अच्छा चलो, वो क्योंकि ये इंटरनेट खराब होता जा रहा है और फिर पिको में कोई होगा नहीं तो मैं चला जाता हूँ, क्योंकि ये मैंने कलेक्शन ली है किताबों से, फिर इसको इस तरह कैटेगराइज किया है। Causes of night blindness. The main cause of night blindness may be divided into 4 main groups. ये भी मैंने किसी चीज किताब से लिया है, लेकिन कोशिश मैंने अपनी तरफ से इस पे ये किया है। जनरल ocular disease 1, 2 inherited disease of the choroid and retina with progressive ectopia. Progressive word यहाँ पे है। Inherited disease of the choroid and retina with stationary ectopia. और fourth है acquired disease of the choroid and retina. अभी देखते हैं और कौन से हैं। Now we are coming to the general ocular disease. Many patients may experience difficulty in seeing at night as a part of the overall visual disability from conditions such as cataract and advanced glaucoma. You now see the pictures of glaucoma visual field defect. This is for you people. The causes are continued. Now, inherited disease of the choroid and retina with progressive nectolopia include the following. हो सकता है इस और भी हो, लेकिन ये जो common है, these are the common one. These are mentioned in different books. So these are there may be, this is not the final list, but there may be other, but these are the common among these common ones. These are rare diseases, but in this rare disease, these are the common ones. Choroidermia, gyrate atrophy. These two, they are red. So these are more common among the other: diffuse choriocapillaris atrophy, degenerative myopia, classic retinitis pigmentosa, and retinitis pigmentosa variants include RP, cyan pigmentosa, sector RP, pericentric RP, retinitis punctata albicans, Leber's congenital amaurosis. So these are the different variants of this. Now, retinitis pigmentosa, retinal dystrophy, initially predominantly affecting the rod cell, with subsequent degeneration of cones. Prevalence is 1 in, this is the retinitis pigmentosa prevalence, 1 in 5,000. Inheritance, isolated form may be without family history. That is the common one. Isolated one is the more common people, that more people will presenting with isolated type. There may be no family history, no family involvement. Autosomal dominant, common, best prognosis. Autosomal recessive, less common, intermediate prognosis. ये severe है बनिस्बत autosomal dominant के, क्योंकि इसमें you know that from the genetics that autosomal recessive are more severe as compared to autosomal dominant. X-linked, least common but severe and almost lead to blindness. The carrier may be females. The male may be more affected because these are X-linked. Fundus will show golden metallic reflect macula with atrophic pigmentary peripheral irregularities. इसकी बात कर रहा हूँ, ये X link sign interior attenuation retinal bone spicule pigmentation and waxy disc pallor. Other sign tessellated fundus appearance, cystoid macular edema, and visible large choroidal blood vessels. I mention this because it is not only the pigmentary changes that you will be able to see, but you will also look for these other changes in the fundus. What will be the test? ERG, EOG, dark adaptation, color vision, and visual field. Prognosis, long-term retinitis pigmentosa. Long-term prognosis is poor due to maculopathy. Ocular association, posterior, ये इंटरनेट डिस्टर्ब हो रहा है, इसमें कनेक्शन प्रॉब्लम आ रहे हैं, जब भी आपको प्रॉब्लम हो तो मुझे बताएं. Posterior subcapsular cataract, open angle glaucoma, myopia, keratoconus, posterior vitreous detachment, intermediate uveitis, and optic disc erosion may be associated with retinitis pigmentosa. Retinitis pigmentosa में ये changes इसमें पॉसिबल है. नाउ ट्रीटमेंट ऑप्शन हमारे पास जो है मल्टीविटामिन्स हैं जो मोर कॉमन है. आया they are working in retinitis pigmentosa because they are autosomal dominant, autosomal recessive, and X-linked. But we are giving these multivitamins. We don't know exact mechanism, but this is a supportive treatment. If you go for the MCQ that my multivitamins are the proper treatment of retinitis pigmentosa, that may be around, because these are genetic disorder, these need genetic counseling and gene therapy. So these multivitamins will, in this retinitis pigmentosa, is not the proper treatment of this. But treatment of complication, yes, they may help if they are presenting with cataract. Cataract surgery will improve, refraction will improve, open angle glaucoma treatment will improve, myopia that is corrected by your glasses, low vision aid, keratoconus treatment that is with the contact lenses, that with CXL क्रॉस लिंकेज जिसे हम कहते हैं और पोस्टीरियर विट्रियस डिटैचमेंट यूवेइटिस की ट्रीटमेंट तो ये इंपॉर्टेंट है ये जरूर दे विल एड टू द इम्प्रूवमेंट इन विजन these are the multiple pictures I will be coming to in detail with this to these pictures like here now inherited disease of the choroid and retina with progression ectopia. This is RP-associated syndrome, Usher syndrome, autosomal recessive, and they have the most common thing is deafness and blindness. These two words will be remembered forever. Other association may be there, RP will be there, then RP will develop, this is before puberty. Usher syndrome is diagnosed based on hearing, audiology evaluation, vision ERG, and balance, electronestegogram, ENG. Nystagmogram, we sit the patient in a chair and we rotate, and we see the eye movements. Involuntary eye movements, which can detect balance problem. So these are the tests that we are going for Usher syndrome. And now these are the fundus changes. These are the pale disc. You see here, Usher syndrome develop retinitis pigmentosa and deterioration of vision है. और ये लेफ्ट ऑप्टिक नर्व पेल आपको बता रहे हैं कि यहाँ पे कितना पेल है जो वेसल हैं और यहाँ पे जो क्रॉस है ये थोड़े से ये स्मॉल है लेकिन little bit may be visible to you. There was no other way to present these slides. So these are the things that double arrow here will show this presence of these pigmentary changes which are present at the periphery of the fundus. So these are the changes, and now you can see also the macula involvement that is also there. So these are the things, optic nerve disc that and vessels. Vessels are very thin vessels which are visible here in these slides. So they are presenting Usher syndrome, and at the puberty you can see dogs there, they can help to the blind person of any type. Is used. There is destruction of the cells that are responsible for hearing purposes. So this will add both with conduction and nerve supply. So these machines are used and they are more expensive, but they will help up to some extent. There's Besson-Wick syndrome, recessive, now deficiency of beta-lipoproteinemia, which leads to intestinal malabsorption. Spinocerebellar ataxia is one of a group of genetic disorder characterized by slowly progressive incoordination of gait and is often associated with poor coordination of hands, speech, eye movements. There may be and ophthalmoplegia. Blood film show acanthosis. These are the blood film. These are RBCs are not as normal shape as they are. So this presentation is called acanthosis. Now treatment if anyone is more interested, just give BC acanthosis, then treatment is vitamin E. In this case, we prescribe vitamin E, and there may be, although they are autosomal recessive, but they can help in treatment. Posterior pole of patient, this की बात हो रही है ये कि posterior pole of patient with abital hypoproteinemia showing pale optic nerve, innervated blood vessels and atrophic retina. So this की बात हो रही है, ये atrophy, ये choroidal जो पीछे वो हैं वो नजर आ रहे हैं, and atrophic retina, mid peripheral bone speak की बात कर रहे हैं. Mid peripheral bone spicule pigment is in some patient. This right, ये आपके की तरफ है, जो आपके सामने है, आपका लेफ्ट इसकी तरफ है और राइट आपका हैंड इस तरफ है, राइट ये है. Refsum disease, autosomal recessive, increased photonic acid 2-hydroxylase. ये क्या कर लेते हैं? They leads to accumulation of photonic acid in the blood and body tissue. Now, what are the signs? Polyneuropathy, cerebellar ataxia, deafness, anosmia, dry scaly skin. ये इसकी बात हो रही है, dry scaly skin जो है. Cardiomyopathy. What will be the test that will be required? That is LP lumbar puncture हम करते हैं इसमें. Elevated CSF protein in the absence of pleocytosis. ये जो tuberculosis में जो bacterial meningitis होता है उसमें जिसमें प्रोटीन ज्यादा होते हैं, इसमें ये एसोसिएटेड होती है. लेकिन यहाँ पे क्योंकि ये ऑटोसोमल रिसेसिव डिजीज है तो इसमें ये एब्सेंस होता है. ये इसके एक खास फॉर्म होती हैं जो आपस में मिलते हैं ये प्रोटीन, तो ये नहीं होता है इसमें है. लेकिन जो ट्यूबरकुलस हैं, जो बैक्टीरियल हैं, उसमें ये चीजें होती है. फंडस जो आपको नजर आता है पर क्यों टाइम कम फंडस इन्वॉल्वमेंट है, उसमें भी साल्ट करते हैं. साल्ट